To wake up fatigued, to wake up missing something that you wish you were at as far as your family. There has to be a passion about what you do that brings you in every day, and there has to be self-fulfillment that's not monetary, that's not awards, it's not recognition professionally, it's personal. It has to be hardwired in. The incidence of congenital heart disease around the country has been a steady number as a percentage for years. It's a problem that's prevalent, it's one that's diagnosed frequently, and it's one, particularly in the last 30 years, that's amenable to surgical therapy where you have a good chance of creating a normal child afterwards.
Most kids can understand an injury if they fall and scrape their knee. I take care of kids who have an injury to their heart. A lot of times it's something they're born with. It can be a hole, it can be a valve problem. So I guess we try and put a Band-Aid and fix their heart.
This is Carolyn Voltage. He was born with a congenital heart defect. It means the world to us to know that there's a place that really knows how to care for him. We can call anytime, and we'll be able to talk to a cardiologist.
And we have.
And just to know that they're always there for us anytime.
I would trust my own children in the hands of this team here in the Cardiovascular Care Center. From surgeon to intensivist to cardiologist to nurse. We have an amazing team.
In my 12 years as a cardiologist, I always have 100% confidence with my patients to tell them that this is where their child needs to have heart surgery. This is where their child needs to be in the cardiac ICU for their cardiac care.
He was 4 days old when he had his first surgery and has had 2 surgeries already, and this will be his 3rd surgery.
There are some patients that we see that are going to require multiple surgeries. And the first being when they're an infant. They're maybe a week to 10 days old. And then we send them home. And then a few months later, they have to come back. And I think as challenging as it is to be the parent of that child to have to face another surgery, there's also comfort in knowing now what lies ahead and who is actually going to be caring for their child.
Community support has been game-changing for us.
We have an amazing facility that not only services our program, but services the entire community. That is only built by philanthropic dollars. If you walk through this hospital, you see sign after sign with names on it of dollars that have been donated. In our program, we can't get by without that.
For me, approaching every patient with that attitude that we're going to try and strive for 100% success in every lesion is the end game.
It is incumbent upon our community, both our professional congenital cardiac community, but also the broader community at large, to really establish a national center of excellence for the care of children with congenital heart disease.
If 1 in 200 children are born with heart disease, as a cardiology network, we can make a big difference as far as making the correct diagnosis. Everybody gets an ultrasound in the state of Minnesota, typically to identify if it's a boy or a girl. We should also be looking at that child's heart, and then starting from the first breath of that baby to have an impact on taking care of that heart problem.
The community support for the cardiovascular program allows our nurses to really advance their care. Not just know what to do, but to anticipate what's coming down the pike. And that is the key with some of these really fragile children.
The Navy has been our model because they train every day for infrequent events. The same goes with us. So without well-trained hands and experienced minds, we can't do our job.
Children are the future. When one fixes a problem in a child, one has a 50, 60, 70-year impact. The WISE community will invest a lot to make sure that their children are healthy.
When we do a heart surgery and we're coming off a bypass and you see that heart restart again, I tell you, there's nothing that's more miraculous than seeing that. When you look at the baby, where you take out the breathing tube, and their first cry, I never get tired of hearing that.
The miracle for me is watching that child in a wagon go home, seeing that child in clinic the following week and follow up, signing his sports form that summer because he's going to camp, and for all of us remembering how sick he was that day that we didn't think he was going to make it is, I think, why all of us do what we do every day.
I spend a lot of time in hockey rinks. Just a couple months ago, a guy points down to the ice, and there's a kid playing in a game. You did a coarctation repair on that. That's my son. He's 9 years old. So every day I'm thankful for that. That's a privilege for us to be involved with that kind of thing. It's a Friday, it's a coarctation repair. A decade later, somebody's playing hockey and a dad has a son. That's what it's all about.